their own introductions. But anyway, I encourage you to ask lots of questions. If there's something pressing along the way, feel free to ask, or we will take questions at the end. If you're listening online and you have questions, please feel free to email those in, and we will convey those to the presenter at the end of the presentation. To get those answered. For those of you online, you should be muted. We encourage you to stay that way just so we don't have any background noise, and also keep your videos turned off so we aren't necessarily seeing everyone in their living rooms. But anyway, I'm going to turn it over to the speakers. If you do have a cell phone in the room, please, we encourage you to mute that now. And then at the end, we will have an evaluation that we would love to have your feedback. So I'm going to turn it over right now to Judy Geissler.
Good evening, I'm Judy Geissler, and welcome to our presentation, Chronic Kidney Disease and Why Women Are at Risk. So like I said, I'm Judy Geissler. I work at the Medical College of Wisconsin. I'm the Vascular Access Advanced Practice Provider. My background is I was a dialysis tech and a dialysis nurse before I obtained my position.
Hi, my name is Barb Alberti. I am a family nurse practitioner for the past 10 years. I work at the VA Medical Center. My specialty is nephrology. I was a dialysis. Okay, let me do that quick again. My name is Barbara Alberti. I'm a family nurse practitioner. I work at the Milwaukee VA Medical Center in the nephrology section for the past 10 years. 6 years previous to that, I was a dialysis nurse. I was actually the one who encouraged Judy to go to nursing school and to nurse practitioner school. Judy and I have known each other for well over 16, 17 years now. My job is to take patients through stage 3 to stage 5 kidney disease, get them ready for dialysis, get them ready for transplant, follow post-transplant. So if you have questions as we are going along, please feel free to interrupt us. Probably anything that you have questions about, I'm going to answer in the next hour. I'm going to have Judy start, give you a little bit of some intro stuff. Okay.
And along with that, in my role, I do the opposite end. I work with the vascular access surgeons that create the dialysis access. So after you see Barb, then I take the other end and I work with the surgeons. So our objectives for today are to discuss the role of the kidney, why kidneys are important for good health, and we're going to discuss common kidney failure preventions and strategies, the labs that are necessary, discuss over-the-counter medications, supplements, and pain medications, the role that they play, discuss diagnostic procedures and tests, the ones especially that involve dye, present risk factors, discuss diabetes and hypertensive control, and provide resources for the patients or our people that are in the audience today. So
I just want to ask a couple of quick questions. I want to kind of get a feel for why you guys are here. Can anybody tell me, are you just interested in kidneys? Have any of you been diagnosed that you're willing to tell us? Have a loved one diagnosed? Anything specifically you want us to gear this towards?
I have stage 3.
Okay.
Does that mean I'm going to have to go on dialysis eventually?
We'll get to that. Okay.
I have mostly normal values, except so it's in that first range, but everything else is normal. I mean, I've had kidney stones, so I have blood in my urine. So I'm here because I want to know, like.
So we're going to talk a lot about prevention, things we can do to keep ourselves healthy. I just want to kind of get a feel for who's out here and what you guys are interested in hearing. So both of your questions will be kind of answered as we go along. Okay?
Someone from online is I'm here to learn about kidney health for myself.
Excellent. Kidney health is so important. I love those little guys, kidneys. Like Judy said, they were 24 hours a day, 7 days a week. So I'm going to let her finish her introduction before I hog the microphone again.
So as Barb said, our normal kidneys work 24 hours a day, 7 days a week. So the little kidney there, he's small, but he's mighty. Most of the time we take kidneys for granted because nobody really thinks about them till they're malfunctioning and not working properly. So the kidney is normally about the size of your fist. So what do kidneys actually do? We all know we go to the bathroom, we urinate, so the kidneys do remove extra fluid. They clean between 120 and 150 quarts of blood per day, and they make 1 to 2 quarts of urine per day. They also make hormones. These hormones regulate our blood pressure. They help keep our bones healthy, make red blood cells, and the hormone that does that is erythropoietin. So when your kidneys aren't functioning, sometimes you have to get supplements of erythropoietin. So they remove toxins from our body, you know, all the extra toxins that our bodies make during their normal day. And they regulate the electrolytes, our sodium, which regulates our blood pressure, our potassium, and our phosphorus. Our kidneys also small but mighty. They activate the vitamin D. You go in the sunshine and they activate your vitamin D. Or you take vitamin D pills, they activate that also. And that's one function that's lost with kidney disease. So here's our little kidney, and you see the little renal artery on the left? That little renal artery takes 10% of the blood that's in our body, and it passes through that artery. And that little kidney has very complex structures in it. One of the structures that's very important, the one that filters, is the nephron. The nephron is on your right, and it has all the little functions and all the little structures inside the little bitty nephron. So with the nephron, those are the areas that we want to maintain their function because those are the ones that do all the work. And that's what we try to prevent with kidney disease. So, as we know, chronic kidney disease has 5 stages. So there's stage 1 through 5. Along with this, the glomerular filtration rate, that's a big fancy word, but what it means is how your kidneys are functioning. This rate is a calculation. It's based on age, weight, height, whether you're a male or female, and your ethnicity, whether you're African American or Caucasian. With the male, if there's a calculation because males have more muscle mass than females, and African Americans have more muscle mass than Caucasians. So that's a little difference in the calculation when you have the labs drawn. And creatinine is also in the calculation. So stage 1, as the table shows, is normal kidney disease, or slight damage is greater than 90. So that's usually where most of us fall. Then stage 2 is mild kidney disease with the GFR, which is the glomerular filtration rate, between 60 and 89. Then stage 3 is moderate disease. That's between 30 and 59. Then you go to severe, which is stage 4. That's usually the rates between 15 and 29. Then end-stage renal disease, which is stage 5, which is the kidney failure. Your glomerular filtration rate, or your GFR, is less than 15. And then sometimes, depending on how sick you are and your symptoms, you can start on dialysis somewhere in there. Turn it over.
Okay, Judy just mentioned a great lab value. How many of you know what creatinine is? What is it?
I mean, it shows how well your kidneys are filtering.
Okay. Do you know where creatinine comes from? Anybody? Come on, spit it out.
Protein.
Nope. Well, kind of protein, I guess you could kind of say that. Creatinine comes from our muscles. So every day as you guys are moving around, your muscles are constantly building up and breaking down and releasing creatinine. Okay, that's what gives our urine a yellow color. It's not something we need to keep in our body. So it's a pretty good indicator of how well our kidneys are filtering. Okay, normal creatinine is between 0.6 and 1.1. The lower the creatinine, the better. It means that your kidneys are filtering out that creatinine more than it's keeping. I always like to make sure that my patients know what we're talking about. If we start talking about lab values, I need to know that they know what I'm talking about. So Judy said that creatinine goes into that calculation. Okay, these numbers, This talks about how much blood is being filtered by those nephrons per minute. You look a little perplexed.
No, go on, no, that's my question after that.
Okay, so let's go on. Judy? Okay, so some common kidney failure prevention strategies. Prevention, drink plenty of water. Sounds pretty simple, but it's all about hydration. Your kidneys are all about filtering, okay? Think of your house. You have the plumbing, that's all the structure, that's what urology does. We don't deal with that. If you have a little water filter on your sink, that's what we're worried about. We're worried about how those kidneys are filtering. So we want to make sure that there's enough blood, enough fluid, enough hydration going through those kidneys. Dehydration can cause an acute kidney injury, which can cause your creatinine to go up, cause your kidney function to go down. I always tell my patients, I want your urine to be a light yellow color. In the morning, yes, it's going to be a little bit darker, okay? But throughout the day, light yellow. If you're thirsty, you're already getting dehydrated, okay? So I don't tell people a set number of water, just drink water throughout the day, make sure your urine's light yellow color, okay? Glucose control. Oh, the evil diabetes. Diabetes is the leading cause of kidney failure in the United States, okay? So remember when Judy had that first, can you go back 2 slides? So remember when Judy was talking about this main artery that splits off into these smaller little arteries until it feeds into this little glomerulus right here? This is where diabetes and high blood pressure affect. They affect these little capillaries in the glomerulus. So what happens is those capillaries become leaky. And when they leak protein into your urine. So how many of you are diabetics and have been told you have protein in your urine? You don't have to answer me. Your urine foamy. When you pee and you get up, you look, does your toilet look like there's little bubbles? That's the protein that's leaking from your body into this glomerulus and out. Now normally with these little nephrons, the little glomerulus in there, that protein is too big to leak, okay? So what happens with diabetes and high blood pressure is it affects these little glomeruli, and that's where the disease starts, okay? Okay, we can go back, Jude. Poor Judy, she's gonna be my... Okay, so Judy and I just recertified our nurse practitioner license for the next year. I had to do a lot of continuing education at the last minute because I'm a little busy in my life. Did a lot of diabetes education. So glucose control, you want to get your hemoglobin A1C down to 6.5 unless there's contrary reasons. Okay. We talked a little bit about hypertension. Hypertension is the second leading cause of kidney failure in the United States. Heart disease is the leading cause of leading cause of death in both males and females. Hypertension has hardening of the arteries. So basically your arteries are more elastic. You want them to be able to move in and out. What happens with hypertension is your arteries become stiff. Those little capillaries within the glomerulus become stiff, and they eventually cause death of that little nephron. Okay. Weight, you know, I've got weight to lose. You know, inactivity leads to high blood pressure, leads to diabetes, leads to metabolic syndrome, a whole host of things. Keeping yourself active. I tell patients one of the best things you can do to keep yourself off of dialysis, or if you're going on to dialysis, is keep yourself active. You know, if you're pretty much couch potato, get up and walk to the mailbox every day. The next week, maybe walk to the mailbox twice. Keep your lipids under control. Okay, your fats, keep your triglycerides. If your doctor, make sure you're getting your yearly or every 2 years or 5 years, whatever the guidelines are now for your lipid management. All of that plays a big picture in your kidney disease. I do want to go back and go a little bit off topic about activity. My 12-year-old is listening online. She has got me moving and walking, and it's killing me. But it's actually making me feel better. So that's my little plug to my 12-year-old who's at home watching me. Okay, next slide. Okay, labs. So we talked a little bit about creatinine already. Creatinine comes from our muscles. Your muscle mass is going to be different than my muscle mass, which is going to be different than his muscle mass, which is going to be different from Judy's muscle mass. That's why it goes into that great big calculation. So yeah, you may get a creatinine. I think my last creatinine was 0.8. Is it a normal range? Yes. Your creatinine may be 0.9, but if you're the petitest little old lady with no muscle mass, that may be elevated. So it's really hard to compare one person's creatinine to another person's creatinine. Okay? So that's why that goes into that glomerular filtration rate. Let's talk about the blood urea nitrogen. It comes from protein we eat. So any kind of meat source, protein source, peanut butter, legumes, breaks down into nitrogen. Blood urea nitrogen is one of the waste products we measure in the lab. Please don't call it a bun. It kills me. It's a blood urea nitrogen, okay? So that is another waste product that we're measuring in the lab to see how your kidneys are doing, okay? Judy did a good touch on the glomerular filtration rates based on your age, your weight, your height, your male or female, and whether you're not African or American or Caucasian. I tell patients try to think of it almost as a percentage. It's more like a amount of blood that's being filtered by those nephrons per minute. Okay, hemoglobin and hematocrit, anemia. If any of you have ever had where you're tired, exhausted, pale, always cold, all you want to do is sleep, you may be anemic. Your kidneys actually regulate your blood count. So remember we talked about 10% of the blood goes to each kidney. Your kidney can tell how much oxygen is being carried on those blood cells. If it doesn't see enough oxygen, what it does is it tells the bone marrow to make more blood cells. So your kidneys actually regulate your blood count, okay? So in patients with kidney disease, if that hemoglobin and hematocrit aren't where we want it to be, we can give them a synthetic medication, a hormone, that will increase their blood count to the range we want it to be at. Okay? Yep.
So I am on my labs, and I guess what I'm wondering is, do you define kidney disease solely on your GFR, or do you have to have like the other labs or urines abnormal?
So the question was, do we have to define kidney disease based solely on labs? In a technical term, yes. So
that wasn't my question. My question is specifically if your GFR is slightly abnormal, so mine's 86, but my BUN is normal, my creatinine is normal, I have negative protein, negative WBCs. So would I still be defined as being stage 2 because I have an abnormal GFR?
yes,
Okay.
because you have that abnormal GFR.
And when you say kidney disease, like I didn't have, my labs were normal, and then I had a kidney stone and they lasered it.
Yep.
And could that damage my kidney? So I really don't have a disease. I just have damage from the laser. So is that still kidney disease?
Disease is the loss of kidney function. It's kind of that big umbrella.
Okay. So it's not a disease, it's just, okay.
You can call it kidney condition, whatever you want. Now, that laser therapy, so she talked about having stones, kidney stones, having laser therapy go in. That laser obviously isn't going to go in and bust up just that stone. It's going to go through kidney tissue. One of the things you might want to go back to your doctor and say, what was my GFR before the procedure? It was normal. Did you have any kind of episodes? Did you have any kind of dehydration, any hypotension when you were, that you know of?
Only post-op, right, in the, after surgery, but just in the post-op, I mean, when they're giving you meds and you're coming out of anesthesia, but
Okay.
after that, no.
Okay. So it's kind of hard to say exactly what the cause of yours was. Have you had it repeated? Have you had your creatinine repeated since?
No.
Okay, that would be a good thing to do. Okay. Let's move on. Okay, so labs. We're still on labs. How many of you have gone to your doctor and given a urine test? It's one of the great screening tests that we can do. It's a non-invasive, pee in a cup. If you have abnormal results, ask your provider, what do these results mean? Judy and I did a clinic for the NKF a couple months ago. A lot of people came in and said, I had abnormal labs. Go back and have them repeated. Okay, make sure what's there is there. Laboratory people aren't perfect. There's laboratory errors that are made. Follow-up. You know, if they tell you that your labs are abnormal, don't hope it's going to go away. Okay? If you ignore it, it's just going to get worse. Okay? You want to be proactive with kidney disease. So what we do, we check the urine for blood. We want to see if those little capillaries in the glomeruli are leaking. Blood, protein, and albumin are pretty close. They're not exactly the same thing. Okay? But that's what we're looking for. Okay? What we do then is we can take that ratio of that protein in your blood, and we compare it to the amount of creatinine, that yellow color in your blood, and it gives us an amount of protein that's in your urine, kind of a quantitative measurement. So that can tell us if your kidney disease is starting out, if it's progressing, if it's responding to meds. Okay? Go ahead. Okay, so women in specific, pretty much for everybody, you know, go have a urinalysis done. They're going to check it for blood and protein. Follow up with another test if it's questionable, and early detection of kidney disease. We just talked all about that. If you guys are having, if you're still in your cycle and you're still having menses, you want to make sure that it's not at that time if there's a contamination. So that's why one result is one result. Go ahead and have your results repeated. Okay? Okay, over-the-counter medications. Tylenol. Tylenol is very kidney friendly. It's excreted and broken down by the liver. 4 grams of Tylenol per day is the recommended adult dose. Aspirin, as prescribed, typical dose is anywhere from 81 milligrams to 325 milligrams. I don't see as many people using aspirin nowadays for pain reliever as much as they do for the cardiovascular benefits. Tums, how many of you take Tums for upset stomach? Do you take a lot of Tums? Every day, 3 times a day, 4 times a day?
I do that maybe once a week.
Okay, so Tums, sporadic use is fine. If you're relying on Tums 4 times a day, you're going to lead to muscle injury. You're going to lead to kidney stones. Typically, calcium is the main ingredient in most kidney stones. Okay. Our favorite NSAIDs. Okay. NSAIDs, non-steroidal anti-inflammatory disease. These are our favorite. Ibuprofen or Aleve, naproxen, Advil. These cause issues with the little nephrons in the kidney, okay? So if you're an NSAID addict where you're taking doses twice a day, every day for months on end, or in the case of Advil, you're taking 800 milligrams 3 times a day, every day for months on end, you're doing damage to your kidneys, okay?
So do you see that damage immediately, or?
Usually it's a long-term effect that we see. Usually it's patients who I've dealt with who have used NSAIDs for years. Usually they typically have some kind of knee problem, back problem, where their orthopedics prescribed it for something else. There wasn't very good follow-up with labs. They just said, here, take this, keep taking this, keep taking this. And then before you know it, people have kidney injuries.
But if you stop, if you've taken it a lot and then you stop and your labs are normal, did you increase your risk?
Yes, you do. Yes. So the question was, if you use an NSAID for a specific amount of time and then you stop, does your risk stop when you stop taking that med? Is that correct? It does not. So once you do damage to those nephrons, they will continue to disease and progress to the point where they die.
But if it's normal, I guess my question is, then does that mean you didn't cause damage, or just mean that?
The only way you would be able to tell if you did or didn't, if you had normal labs and you wanted to know if you did damage, the only way you would know is by doing a kidney biopsy, where we go in and take out a needle and take out a sample of that kidney and look at it under the microscope. So it could be a combination of having diabetes, having high blood pressure, using NSAIDs. You know, once we hit age 40, we start to lose kidney function every year. You know, you could have bout of dehydration where you cause some additional damage from being volume depleted to your kidneys, all those things kind of add up. It's usually not one thing in specific that's going to lead to the kidney damage.
You know if hydrocodone is an NSAID?
Hydrocodone is not an NSAID. Okay, so big thing with NSAIDs, make sure you're keeping yourself hydrated, limit the amount and duration. Your provider for using it for more than 10 days in a row. Okay, sporadic use here and there is not going to be a big factor, but like I said, if you're using it 3 times a day for months on end, you're putting yourself at risk. I think one of the things Judy and I talked about what we forgot to put on the slides when we had our last presentation, where did we throw in soda? It is? Okay, then we'll leave it. Okay, supplements. There are no proven supplements to benefit your kidney health. I have patients come in with, I found this kidney cleanse on the internet. I found this that says it's going to make my kidney function and improve, and I'm going to beat this. I said, we don't recommend anything from a nephrology standpoint. There's no FDA approved medication that is going to fix your kidneys. If it did, we would be out there pushing it all to everybody. There's no clinical studies that show any benefit. A lot of things are diuretics. So what they do is they make you urinate a lot. So you think, oh, I'm cleaning out my kidneys. And actually what you're doing is more damage because you're dehydrating yourself. Vitamins, depends on whether they're fat soluble or water soluble. You can overdose on fat soluble vitamins. Water soluble your kidneys tend to regulate those, but if your kidneys are failing and not doing very well, you can have a buildup of the water soluble vitamins too. Okay? Okay, Judy. Okay. Yes?
Water pill, where does that come in? I know that's a prescription, but.
So water pills, you know, that's a great question because I recently in the last year got diagnosed with high blood pressure myself after starting on a new medication. What's the first thing they throw at you? They put you on a water pill. Okay? I hate it. Okay, I have a new sympathy for my patients who are on water pills, especially when our kids and I take a trek to Illinois for a merit badge for scouts. Okay? So water pills are unnecessary evil. Okay. I tell my patients I need to get the fluid off of your leg. I need to get the fluid off your belly. I need to get the fluid away from your lungs. God forbid you have fluid on your heart. That's a medical emergency. But we need the diuretic to kickstart those kidneys into urinating more. But I tell them I also want you to drink a lot of water. So here I am walking around with my bottles of water, you know, drinking. So it's one of those necessary evils. Good thing is limit your salt intake. Our bodies love salt. Pretty much when you look at that nephron, your kidneys filter almost everything out. And then as it goes through those tubules, it starts to reabsorb stuff back in. And one of the first things it grabs is salt. Our bodies love salt. It goes back to the days when we were starving and we were dehydrated and we didn't have food. And the people who could reabsorb that salt tended to survive better because they didn't get dehydrated and die. There's actually a theory out there called the passage theory about why African Americans in our population tend to have more high blood pressure. And the theory goes is that those that were passing from the slave ships from Africa to the States, those that had the ability to retain their salt tended to get not dehydrated and didn't die in passage. And that's why the African American population in the United States tends to have higher blood pressure, because the ones who did not retain salt ended up passing away.
Is there certain supplements that tend to be bad for you?
Anything that is going to dehydrate you. So nothing in particular, as long as you're following your recommended dosings. You know, Judy talked a little bit about vitamin D that your kidneys make. I bet you, there's 20 of us in here, I bet probably 18 of you are vitamin D deficient. How many of you, I take a vitamin D supplement every day. How many of you had your vitamin D levels checked? Okay, are you on supplements? Okay, sorry, but we're pasty white people in Wisconsin. And as it is today, it's raining outside. We don't get enough sun. We were born to be outside and naked, working under the sun.
So how does vitamin D affect your kidneys?
Vitamin D doesn't in itself affect your kidneys, but vitamin D, because it's regulated by your kidneys, affects a whole host of other things. It plays a role in your bone health. It plays a role in your cardiac health. Vitamin D is found to play a role in testicular cancer in men, breast cancer in women, diabetes control, weight control.
So I guess because I've had kidney stones, my understanding is there's a study or studies that show if you take 5,000 milligrams of vitamin D, which is really the amount I read that you need to increase your vitamin D level, causes kidney stones. So I'm in a catch-22 because I want to increase my vitamin D, but I can't get the 5,000 level according to like the study.
So the scenario is that she's trying to increase her vitamin D, but when she increases her vitamin D, she gets kidney stones. What vitamin D does is it also allows your gut to pull calcium into your body. That's where your stones are coming from, is that increased calcium in your body, and that settles out in your kidneys. Have you talked to your nephrologist about ways to make your urine a little bit more acidic so that you're not as likely? Okay.
I've really done the 24-hour, modified my diet, all that. Yes.
There's activated forms of vitamin D. So there's vitamin D that the general public takes, and there's vitamin D that we give to our dialysis or end-stage renal disease patients. It's a form of vitamin D that doesn't need to be activated. Maybe it's not measured in the typical vitamin D testing, so maybe that might be a better option for you.
Is it a vitamin D2, not the D3? Or?
It's a D125, 1,25. Okay. So let's talk. We're really getting off hand. I hope you guys don't mind. Okay, so procedures involving contrast. Elective MRI, CT scans. If you go and you need a test and you are at risk of kidney disease, if you have a GFR less than 30, you do not want to get contrast. What happens is that contrast lines up those little nephrons and causes them to die. Okay? So if at all costs, you guys want to avoid contrast. They can give you hydration. You're still going to be at risk. The second that contrast goes into you, it's going to settle out in the kidneys. Now, God forbid, you have to have a cardiac cath to save your life, and they're going to give you dye to see how your heart's doing and open up any stenosis. They would rather trash your kidneys and keep you alive. So we see a lot of patients who, after they have a cardiac procedure, their kidneys are suddenly shot. So kind of that catch-22. You're alive, but now you got kidney disease. Okay? So talk to your doctor about any scheduled tests, appropriate hydration. Can it be done without contrast? Some tests you can see what you're looking for with or without. Kidney stones, usually we don't need contrast because they're calcium-based. Okay? Any questions on that? Okay. Family history. Okay, we can beat this to death. Diabetes. If you have a family history, you're more likely to develop diabetes. Check your glucose. Have your kidney function regularly tested. Ask them what your numbers are. I have way too many patients who said, oh, for years and years, everything was fine, everything was fine, everything was fine. And then all of a sudden now I'm here talking to you and my kidneys are failing and you're telling me I'm going on dialysis in the next year. Okay, know what your numbers are, know what they mean. If you have questions, ask. Okay, high blood pressure, narrowing of the arteries makes our vessels leaky and hardening. It's the way the Americans are going. We have high blood pressure, we have diabetes. So one of the things that you cannot control is something called focal segmental glomerulosclerosis. Big words, FSGS. It's a disease that affects the little glomeruli in the kidney, causes them to be scarred. It is a hereditary thing. Other kind of hereditary things we have, is there another slide, Judy? Polycystic kidney disease. As we get older, we get cysts everywhere in our body. We get them on our liver, we get them on our ovaries, we get them on their kidneys. They're nothing more than fluid-filled sacs. If you go and have an ultrasound done, they're going to look, you're probably going to have cysts on your kidneys. As long as they're not solid looking like a tumor, there's usually nothing you can do about them. Okay? Go ahead and say that word, Judy. That's for yes. So that's when we have inflammation of the kidney. So things like strep can cause inflammation of those glomeruli. That can lead to scarring down the line. So, you know, they always worry about kids and scarlet fever, which is related to a strep. One of the things is kidney problems down the line. Congenital abnormalities of the kidney or urinary tract infection, anything that might cause that urine to back up into the kidneys called hydronephrosis can be damaging to those nephrons. Okay, any questions on that? Okay, a little bit more. Lupus, autoimmune disorder. Women in particularly are very prone to lupus. Lupus is horribly hard on your kidneys. Okay, pregnancy, there's maybe one person in here who might be at childbearing age. She's well, still wanting to have children, let's put it that way. Increases the risk of high blood pressure, increases the risk of diabetes, preeclampsia, eclampsia, which causes chemical changes with your body, including really high blood pressure. Urinary tract infections. Especially when they move up into your kidney. So most of us have experienced a UTI where we've had lower urinary tract symptoms, burning, urgency, frequency, pain with urination. When you have something called pyelonephritis is when that infection moves up and it actually settles into your kidney. It's quite painful. It's almost as bad as a kidney stone. I say I had it once. I say it was worse than having my daughter. Okay, it was extremely painful. Okay, so if you're getting pain in that flank area, and you're having to go frequently, go to the urgent care. It's not going to go away on its own. Go get antibiotics. You don't want to risk. Oral contraceptives increases the risk of blood pressure, increases the risk of diabetes, and increases the risk of blood clots. Okay, any questions on that? Obesity, leading cause of diabetes, high blood pressure, metabolic syndrome. What are we going to do? We're going to tell you the diet. We're going to beat this into death. You know, it's what we counsel all of our patients about. This is what nurse practitioners do. We educate, we educate, we educate. We try to lead you into health. Smoking. How many here of you still smoke? Anybody? Yay. Smoking is the cause of kidney cancer. Okay. Typically only people who smoke get kidney cancer. And then what happens when you have kidney cancer? Usually the doctor finds it on a routine urine. You go to the bathroom, pee in a cup, you have blood in your urine. Why do I have blood in my urine? Do another test, you come up with blood in the urine again. Well, that's really odd. Doctor sends you for an ultrasound. They find a tumor in your kidney. Looks kind of suspicious. Maybe they wait 6 months and see what it looks like again. 6 months later, it looks a little bit bigger. Well, now they're getting a little nervous. They're like, we're going to go in and take that out. Okay, so what happens when surgery happens and they go in and they take the tumor out? What else are they taking out? They're taking out a lot of healthy tissue of the kidney. So basically what they're doing is they're going in and they're getting clean margins around that kidney and they're taking out a lot of healthy kidney tissue. So right there, not only are you at risk for cancer, but you're also taking away healthy kidney tissue by getting that kidney removed. Okay? Smoking causes hardening of the arteries, high blood pressure. You guys know all that. Toxic substances. We talked about medications, dyes, anything that's a vasoconstriction. You want to ask your doctor and your pharmacist, is this medication okay for me with my kidney problems? Most pharmacies out there have programs that'll flag you and say, at this GFR, you should be having a less dose of a medication because it's cleared out by the kidney. Some medications are toxic to the kidneys. You definitely don't want to be on those if you're already having kidney problems. Illegal drugs. Anybody on crack cocaine? Anybody smoke marijuana? Believe me, there are people that I wouldn't have expected to be on drugs who are in my clinic. Causes hypertension, okay? Causes hardening of those arteries. Excessive alcohol use, less efficient filtering. There's a lot of closet addiction out there. Okay. Other disease processes, you pretty much name it, it's going to affect your kidneys. Okay. Risk factor, acute kidney injury. Anybody can develop an acute kidney injury. I had an acute kidney injury. I got, my kids got sick. My husband at the time got sick. Everybody was throwing up, diarrhea. I was the only one that was healthy till the next day. I was so dehydrated that when I went to my elective surgery on Monday, my urine was brown. Brown. The nurse didn't say a thing when she took the sample from me. I looked at that and I'm like, yep, turned to my husband and said, I have an acute kidney injury. So what happened is I dehydrated myself so much over the course of the 3 days when I was sick that I caused an acute kidney injury. Now your kidneys can do three things: is you can recover back to your previous function. You may only recover some of your function, or some people don't recover any of their function and they have a huge drop in their kidney function. Okay? So if you have kidney injury, you have kidney disease, you want to make sure that you're keeping away from people who are sick. Get your flu shot, get your pneumonia shot. If your kids, your grandkids are sick, honey, I love you, I just can't hug and kiss you today. Okay? You got to keep yourself healthy. Okay? You don't want to risk kidney injury. Kidney injury can happen from things simple as car accidents, pneumonias, any kind of thing. So do what you can to keep yourself healthy. Okay? Causes, dehydration, shock, whatever. Judy just skipped by. Okay. And cardiac arrest can cause kidney injury. Okay. Risk factors, medications, we talked a little bit that. Diuretics, necessary evils. You want to keep yourself hydrated. ACE inhibitors. How many of you started on the ACE because they said you had protein in your urine? ACE inhibitors like lisinopril, losartan is an ARB. These are excellent for kidneys. They cause decreased pressure in those little glomeruli. Remember that structure Judy showed you? Had that little glomeruli. It decreases the pressure within there. And that causes decreased leak of the protein. ACEs are wonderful as a first-line blood pressure med to prevent kidney disease. Sometimes it causes your creatinine to go up, and then they take you off of it. Okay. Sometimes that creatinine goes down and goes back to normal. Sometimes it doesn't. There may be some damage there. Metformin. Metformin, I don't know the exact mechanism, but it can cause your creatinine to go up. Once your GFR gets to below 30, I believe, they pull you off of metformin. Okay, next one. More risk factors. Chemotherapy. I've had patients in my dialysis clinic who started because they had breast cancer, who had chemotherapy, and the chemotherapy trashed their kidney. Okay. One case, I don't remember if you were working at the time, we had this lovely lady who donated a kidney to her son. She subsequently got diagnosed with kidney or breast cancer, and then her kidney was trashed by the chemotherapy and she ended up on dialysis. Once you get diagnosed with cancer, it's a 2-year waiting period before you're eligible for transplant. She was able to get on the transplant list and she was immediately transplanted because she had donated a kidney to somebody. She went first in line. She got a kidney. But chemotherapy, I actually have a guy in my clinic who is undergoing breast cancer therapy. Same thing I tell him, keep yourself hydrated. You know, you got to do what you got to do to keep yourself alive. Okay. Kidney stones, we talked a little about that. Obstruction. If the stones are obstructing, they can be obstructing or non-obstructing. It's just like it sounds. If they're obstructing, they're preventing the urine from flowing down into the bladder. They're causing buildup of that fluid back up into the kidney. So there's a pocket of fluid, creates a pressure, and it causes kidney damage. Okay. Usually people are coming in because they're in pain. Okay. Okay, Judy. Oh, how much are we going to talk about diabetes and hypertension? Okay, so we know those lifestyle changes. My daughter's got me walking, diet. I'm trying to cut down on the salt. I am a total salt freak. Dash, you know, we want you moving. Exercise, walk, any kind of cardiovascular exercise. We want you moving, okay? Get your blood pressure checked 1 to 2 hours after you're taking your medication. We want you sitting quietly for 5 minutes, feet on the floor in front of you, not crossed, no smoking, no caffeine, no talking, snug blood pressure cuff. 1 to 2 hours after your medication. I want to know where your blood pressures are at home, because a lot of my patients' blood pressures at home are really good. They come and see me, they love me, but they don't want to talk to me. They don't want to hear what I have to say, and their blood pressures are through the roof. Okay, so you want to give your doctor, your provider, some really good information. Caffeine. How many of you are caffeine addicts? Okay, I never got into the coffee. I never got into the coffee thing, but my kids will tell you I drink a Mountain Dew every morning for breakfast. Okay, I'm 48 years old. You know, it's a habit I can't get rid of. Caffeine causes your blood pressure to go up, causes some tightening of those little glomerulus, or those little capillaries in the glomerulus. Okay, watch how much caffeine you're drinking, especially if you have high blood pressure. Diuretics, you don't want to become dehydrated. Any kind of medication that's vasoconstrictive. Anybody in here, and like I said, you don't have to answer, have fibromyalgia. Okay, a lot of the medications that they use for fibromyalgia can cause secondary high blood pressure. Okay, so if you start on a new medication, no matter what it's for, make sure you're getting your blood pressure checked. Blood pressure does not always show symptoms. Okay, your blood pressure may be 180 over 100 and you may feel perfectly fine. Okay, so you're not going to know, so get your blood pressure checked, especially when starting new medications. Okay. Before Judy goes into resources, what kind of questions do you ladies have for me, or gentlemen? This is my life. This is what I've been doing. This is what I'm going to do until I retire. I love kidneys. I love what they do. They affect everything. They're these awesome little structures. I think they're very interesting. Yes?
So somewhere I thought I read in here, it must have been in this book, that the normal range for the GFR is based on your age. So it was different than your chart. So like once you turn 60, you know.
Your GFR doesn't change. The normal range does not change based on age. That very first couple slides that Judy showed is for everybody. So this is across the board for adults kidney failure, because that GFR, that glomerular filtration rate, takes into effect your creatinine, your age, your weight, your height, and your gender.
Right,
Did I get all that?
So I'm specifically confused by this brochure then, because this says the GFR declines with age. If you're 60 to 69.
Well, that's what every one of us is losing kidney function as we hit age 40. I mean, once you hit age 40, you're losing function.
Right, but technically, an 85 and your other is.
We're still going to classify them as having kidney disease. Even yes.
It says this is normal?
Yep. Yeah. Because we're going to want to do all those preventative things to keep them healthy. Usually people don't see a nephrologist until they're stage 3. This is typically when we get our patients. Every once in a while, we get a patient in this stage. Maybe once every 6 months, I get a patient here and there's nothing I can do with them. I teach them how to get ready for dialysis.
So basically, stage 2 and 1, you just do all the stuff you said. Like,
Stage 2 and 1 can be handled by your primary care. It should be good blood pressure management, diabetes management or prevention, weight management, lipid control, diet, exercise, hydration. All of that's what we want you to do in stage 1 and 2. Typically, stage 1 and 2 is when somebody has an acute injury. So technically, I probably am in a stage 1 kidney disease because I had an acute kidney injury where I had the brown urine, and then my GFR is back up to greater than 90. So the fact that I had that kidney damage by that acute injury in itself defines that I have stage 1 kidney disease.
but so whenever you have the brown urine, I mean, isn't that just old blood? Is that what brown urine is, or not?
It's sediment that collects within the tubules of the nephrons and cause casts to come out of your urine. So protein gets leaked into that structure, and then there's blood in there, and it gets trapped into the tubule that comes out into the urine. You don't want blood in your urine.
Right, but isn't that typical if you have a kidney stone?
No, not cast like that. Usually a blood,
Like red, not
yes,
brown.
not brown.
So from what you said, that medications to help your kidneys come from controlling your blood pressure and diabetes. That is what is like helping or assisting your kidneys. There's no like other medication.
No. So the question was, is there medications other than those to control our blood pressure and our diabetes that we can use to help our kidney? Unfortunately not. If there was, I would be rich. But no, it's keeping yourself healthy. You know, the kidneys are, you know, they're not optimal structures, but they kind of take the brunt of the damage from all the other things that we've got going on. I'm just making my way back. Go ahead.
I apologize.
I didn't notice.
Well, GFR, this is something that I would have to ask my primary care doctor to draw.
Nope.
It's not just that.
It is automatically done on every basic chemistry panel. When you go to the doctor, so the question was if you have to ask the doctor specifically for a GFR test. No, you do not. When you go, your doctor's going to run a basic chemistry panel on pretty much every single one of you. I guarantee it. I do. It's going to come up with your glucose level. Are you diabetic? It's going to come up with your creatinine. It's going to come up with your blood urea nitrogen. By the fact that you checked into the doctor's office, they know how old they are. They know what ethnicity they are. They know what you weigh. It automatically goes to the lab. They calculate that GFR. So, how many of you have healthcare systems where you can go online and look at your lab results? How many of you actually do? Okay, I encourage everybody. If you have questions, you don't like what you see, talk to your doctor. You know, make sure you're keeping yourself well hydrated before you go in and get your labs. Let me catch that nice lady in the back, and I'll come back up for you, okay? Yes, ma'am.
How long are these stages in terms of years, months? Do you think from one stage to the next pretty fast or not?
Well, that is the magic question, and there's no answer for that. It really is dependent on each person and what their underlying factors are. I have a patient in my clinic right now who I've been following for almost 10 years, who has slowly progressed from stage 4 into almost needing dialysis. I have patients that sometimes I see for 2 months before they need dialysis. So there's really no way. If you ever graph out your kidney function, your creatinine or your GFR, you're going to look at it and it's going to be up and down, up and down, up and down. Okay, if you have enough results. Like at the VA, we have this excellent charting system. I can pull up somebody's creatinines for the last 10 years. Okay, what I tell people, I want to see where that number is trending to. On a day-to-day basis, I don't really care what that number says, but it's kind of like the stock market. Are you going to buy, if you're looking to buy a stock, you're going to look at that stock trending up and down and going up. Is it staying flat or is it going down? That's what I'm looking for. Okay, sometimes, to your question, I can guess from where a creatinine starts to where it is now and how long it's been trending down. I can give a patient the best estimate of how long I think they have until they're going to need dialysis. That's very individual to each person. Sorry. So move, diet, exercise, hydration.
Okay, so in my stage 3 for many years, and it doesn't change.
That's great. Don't rock the boat. You know, the only thing I can tell you is, you know, keep yourself active, keep yourself healthy. It is totally, you know, have you ever seen a physical therapist who say motion is medicine? I totally agree with that. Once my patients stop moving, once they start relying on a cane, and then they start relying on a walker, and then they get lazy and they get a wheelchair around the hospital, and then they get a motorized scooter, I see it go downhill very quickly. Okay, no moving.
Real quick, I had preeclampsia and my kidneys did fail. I mean, it's just once. Does that have damage?
It could possibly, once you have a single episode of an acute injury, there is more likelihood that you can have another acute injury and that you may not recover your function after each, as much as after your each acute injury. So definitely keep an eye on that. Yes, ma'am.
When I have my blood work done for kidneys, it usually says stable. Once in a while it says normal. So I don't know what that means, that everything's all right basically.
Normal is you're in that normal range. So usually what the doctor's going to tell you is your creatinine. That creatinine is on normal 0.6 to 1.1. Okay. The more doctors give you for information, the more they're going to get questions back. So what they're going to tell you is your kidney function is stable. Stable, it hasn't changed. Okay? It can be abnormal and not change, or it can be normal and stable and not change. So you really want to see what your doctor's lingo is. Go bug his nurse. You know, nurses are great for education. Nurse practitioners, our background is nursing. So we are educated. We educate. Nurses will love to talk to you about that. Okay? More questions? Yes.
So you're saying that, you know, you see patients to follow them and you're helping them out before dialysis. What are you exactly doing for them other than what you already said, telling them, you know, don't be diabetic, you know, all the stuff you said? Or is it some other things that you're doing for these people?
I am, in addition to everything that I talked to you guys about, I am working on diet and exercise. I want patients moving. Okay, I'm working on their blood pressure control. I'm getting them to follow up with their diabetes. I am watching their anemia management. Judy talked in the beginning about labs. If your blood count starts to decrease, your heart is working a lot harder to get blood and oxygen to around your tissues. So I am doing medication and erythropoietin to get their blood count up into a normal range. I am getting them ready for transplant if they're eligible. It's an extensive process to get people worked up for transplant. I am referring them to Judy to get them ready for dialysis. If you need dialysis, you're going to need something in your arm called a fistula. A fistula is nothing more than a connection between an artery and a vein. Okay, I tell people, think of it as a garden hose. Your garden hose is going to be like your vein. When you're not using it, your vein is going to be a little bit flatter, just like your garden hoses, right? Okay? So then what happens is we surgically connect, not we, not me, the surgeon, we connect the vein to the artery, okay? What happens to that hose when you start pumping water through it? It gets bigger, it gets harder, and if you leave it baking in the sun long enough, it's going to stay that shape. Okay, that's what happens to that artery. That's the fistula part. It gets bigger, it gets harder, and it gets firm. Okay? Then what happens when we do dialysis is 2 needles are put into that fistula at each dialysis treatment, one for the blood to come out to go through the dialysis machine, and the second one for the blood to go back in. So when I decide that the patient is far enough along in their kidney disease and they're not able to beat it like they told me they were going to, I send them to Judy. Judy gets them set up with surgeons. Okay? I cannot tell you, any of you who are thinking I'm just going to ignore my kidney disease, how many of my patients say to me, I wish I would have listened to you a long time ago. Okay? I don't have the best news to tell you, but I really try to get you as prepared as I can. Okay? I'm also doing, let me finish this question. I'm also doing bone disease. I'm checking patients' parathyroid levels. You have your thyroid in your neck. We've all heard of our thyroid, right? How many of you have heard of your parathyroids? Okay. So your parathyroids are 4 pea-sized glands on top of your thyroid. Okay? In kidney disease, those parathyroids are going to get stimulated and they're going to go high. You're not going to come to me and say, hey, Barbara, I'm feeling really exhausted. My parathyroids are off. You're not going to know a thing. Okay? But your body knows those parathyroids are off. And what's your body going to do once those parathyroid levels go down? So it's calcium. Where's the biggest source of calcium in your body? Bingo. I wish I had a prize to give you. So your body takes calcium out of your bone, puts it in your blood to push those parathyroid levels down. What happens to that extra calcium? Causes stones, causes coronary artery disease because it makes your arteries more bone-like, causes them to be hard. Okay? So I'm trying to prevent coronary artery disease. I don't care how big you are, your blood vessels in your iliacs are all calcified and you have nowhere to attach a pliable kidney, you're not going to get a transplant. So I want to take care of bone disease. I make sure patients are vaccinated. I make sure they have Pneumonia vaccinations, hepatitis vaccinations, make sure they have their annual flu vaccinations. I tell them to avoid their grandkids if the grandkids are sick. Your blood gets a little bit more acidic. Sometimes we have something called acidosis. Acidosis, we've heard some talk about acidosis feeding into cancer cells. Acidosis can cause your kidney to progress quicker. So I'm giving a medication to control that acidosis. Some people have high potassium levels. High potassium or low potassium levels can kill you, causes your heart to go into an arrhythmia. Phosphorus levels. Phosphorus is all those great things that we in Wisconsin like. Cheez-Its, crackers, any sodas in here, Coke, Pepsi, anything that Wisconsin likes, people like meat, beer, cheese, bread, all has phosphorus. Phosphorus goes up, causes your calcium to go down, stimulates your parathyroid, causes bone disease. High phosphorus levels can lead to itching. Is that all I do?
There's more, but I can't tell you.
That's the majority of what I do in my clinic. So I have an hour for my first new patients, probably about an hour to start with you, teaching them everything I just taught you. And then I one-on-one, and then I see them followed for half an hour. I check their labs, and then I make medication adjustments. Yes.
We have a question from Jack, who's online
Hi, Jack.
and doesn't want to come to you and say, I wish I had asked you a long time ago.
Okay.
As a 21-year-old, what would you say is the most important thing I should be doing regularly to promote my kidney health?
Jack, you should not, what can you do to promote your kidney health? Jack, you should not be smoking. You should be drinking in moderation. You should be making sure that your lipids are checked, that you don't have any congenital problems that may have high lipid levels. You want to make sure your blood pressure is normal. You want to make sure you prevent diabetes, get your weight down, keep yourself active.
Drink water.
Drink water. Drink water and move. Drink water and move.
Go to the mailbox twice.
No, well, like I said, you for the second week you got twice, and then I want you down to the end of the hallway and back.
Thank you.
There's great apps out there for you guys to keep track of your mobility. Just Google free walking apps. My daughter and I have one called Walk for a Dog. We donate money to some organization that we pick, and it tracks our mileage, tells us how fast we're going, how long we're going, and then it tracks us. So we're held accountable. There's so many tools out there. You know, the biggest thing I tell my patients is don't lie to me. Okay? Anything that you tell me, I can figure out a way to work with you. Okay? You know, I have a 92-year-old patient who asked me, is it okay if I have a shot of brandy every week? I'm like, yes. Like, as long as you're not having 4 or 5 a day. Okay? I'm never going to tell you you can't do something, because then you're going to do it and then you're going to lie to me. So please be honest with your healthcare providers. Okay? Anything else? Yes.
Since the structure of the kidney, right above the kidney is our adrenaline gland.
Yes.
Do they have any impact upon your kidney?
No. Nope. Your kidney health is really the arteries that are going in and how those arteries are being damaged, unless it's like a congenital disease. Can you back up to the
Kidney?
Yeah. So that artery, this is the main artery coming down from the heart. 10% of blood goes to this side, 10% goes to this side. That artery keeps breaking down into smaller little arteries until it feeds into the glomerulus and this little capillary bed. Okay, and then it goes in, pulls out all the waste products that start going through the tubule. The tubule starts bringing everything back in. It brings back in the sodium, it brings in a lot of the glucose, brings in the water, brings in some of the creatinine even. Okay, and the blood goes back, and this capillary actually wraps around this nephron so that there can be an exchange of those products going from this tubule back into the blood. You have about 500,000 to 1 million of these little nephrons in the outer kidney. Okay. Once they die, they're gone. They don't grow back. So let's say we talk about GFR, and you think of it kind of as a percentage, and your GFR is at 30. Sometimes people don't understand that concept, so I say, think of it as a percentage. So of your nephrons, only 30% of them are working. But that's a horsepower, it's overall 30%. It's not like 70% are gone and 30% are healthy. They're all running at 30%, so they're kind of damaged. And eventually they're gonna fail, okay? Yes?
What causes like the blood in the urine? Like I assume that if you have a kidney stone, it's like rubbing against causing blood, but is that what's really happening?
Yes, so if you have a stone in here, in the collecting ducts here, you have a in the ureter, it's just like getting scraping on your skin.
Right.
You're scraping this and blood is leaking in here. You can also have disease of the glomerulus disease. So like diabetes, what happens is this glomerulus becomes leaky and blood leaks from that capillary into the cortex or into this Bowman's capsule, and then the blood goes down. So you can have blood from different causes. So the first thing that they're going to want to do when you have blood is they're going to want to do a scan. They're either want to do a CT scan or a ultrasound. They're going to want to see, do you have a stone? Do you have a tumor? Okay. Actually, the first thing we do is check you in to see if you have a urinary tract infection. If you have a urinary tract infection, then we treat your urinary tract infection, because what happens is the bladder that's down here can get irritated by bacteria and cause blood in there. Okay. So if you have a urinary tract infection, we're going to fix that. You don't have a urinary tract infection, we're going to do a scan. If your scan looks good, you have no stones, you have no. Next thing we're going to do is we're going to biopsy you. Urology is going to say, adios, there's nothing I can do for you. You're going to go see nephrology. You're going to get set up with me. I'm going to set you up for a kidney biopsy. We take a really long needle, we go into your back, and we take out 3 pieces of kidney into the lower pole of your kidney. We're looking for the ebola guys. We want to see what they're telling us under the microscope. That is the only definitive way we can tell you exactly what's going on with your kidney, is by doing a kidney biopsy. And then those are pretty much the steps.
If you have an acute injury, like you had that brown urine, is there anything you should be doing?
Control my blood pressure.
I mean, is that like, it's not an emergency thing?
Well, yes. I mean, if you suddenly have brown urine and you're dehydrated, you should be going to the hospital and getting fluids and stuff. Okay. It's
So that's good hydration
most acute ATN, acute tubular necrosis, where you get those brown casts, is most likely from dehydration, and you want to get yourself hydrated.
Okay.
I was a stubborn, 30-something-year-old with 2 kids at home. Yes.
How do you control your blood pressure?
Medication, lose weight, diet. Salt, we talked about salt. Your bodies love salt. You want to decrease your body mass. I'm sure if I started exercising and lost 50 pounds, I could get off my blood pressure meds. But I also work full time, and I get dragged into these funny things by my friend here. So, we always, if your blood pressure is super high when you're coming to first see us, we tell you lifestyle modifications. Control your salt, control your diet, start exercising. If that doesn't work, we're going to throw you on a diuretic. Typically, the average American is on 3 blood pressure medications. Yeah.
What if your urine is getting white?
Fine. As long as it's a light yellow color. White just means you're hydrating yourself. And no offense, ma'am, but you don't have as much muscle mass as you probably once did. So your muscles are not turning over as much. So your body's not naturally creating as much creatinine. So if you came to me and your creatinine was maybe 1.1 and it was still within normal range, I might say, Mrs. B, your creatinine's normal, but you may have some degree of kidney damage because of how much muscle mass you have. It's kind of like a false indicator. Okay. Now, if you have some super hunky steroid guy who's pumping iron and his creatinine is 2.2, that may be perfectly normal for him because he's got so much muscle mass. That's why we go into that GFR to kind of standardize everybody. I can talk to you afterwards. Okay, anything else? Let's wrap this up, unless you guys have any other pressing questions. Okay, I kind of monopolize things. Let's let Judy finish up here.
I want to thank Barb for the wonderful education that she provided everybody today. She's the expert because that's what she does for a living. So resources, there's always resources. Barb had mentioned, ask your healthcare providers. There's something you don't know, ask them. The nurse will tell you, the doctor will tell you, somebody will tell you. Use your advanced practice providers like we are. Use your PAs, your physician's assistants.
Dr. Google is not always the best choice.
No. So you have the local kidney foundation, the National Kidney Foundation. You have National Institutes of Health. If you go to any website, you can see I've listed them here for you. You can use the U.S. Department of Health and Human Services. They're good sources. So some resources from the kidney, you have them on the table. They're in the back. You can get them online. Get from kidney.org. Some more sources. They touch on very, very, very good topics. Now, Barb said, Dr. Google, he's not your friend. Not. The internet's wonderful. Lets us find lots of things, but do you trust the source? You go to your neighbor, do you ask your neighbor? I have this ache and pain. I have this ache and pain. What's wrong with me? You're not going to get the same answer that you get from a provider. So if you see this code, if you scroll down to the bottom of the page and you look, there's a bunch of little pictures, pretty little pictures. If you see something like this or like this, these are accredited sites. You know, when you go to fix your refrigerator, you look for the Better Business Bureau. Same kind of thing. Don't do Dr. Google. You can do Mayo Clinic. You can do certain things, but look for something on the website that has edu and .gov. Those are sure things. So like I said, this is the most common. You can use PubMed with the NIH and Medline. Medline Plus, it has .gov after it. So know your websites. Know your sources. Don't ask your neighbor. This I got right off the NICH government. It says, who runs it? Who runs the site or the app? Can you trust them? What are they promising? What are they offering? Is the claim to be good to be true? Somebody says, I'm going to give you $1,000. You're like, okay, no. Just make sure it's true. When the information was written and reviewed, on the bottom of the page, you scroll down, it has a review date. You can see if it's reviewed. Most sites do it once a year, but if you have something from 2009, you're not going to want it. You're going to want something from 2018. So look for the dates on the bottom of the page. So where does it come from? Us as providers, we like to say this study, this said this study said that. Did it come just from somebody's blog? No blog. Did it come from a study? Yes, it's good. So how does it exist? Is it selling something? So what I'm saying, you know your sites, know what you're looking at. Blogs can say anything. It's not scientific and you don't know who's sitting on the other end of that blog. Yeah, you want the good information.
Especially anybody who's asking you to buy anything. Any kind of kidney cleanse or anything like that. Be very
Barb said, watch if somebody wants you to buy something like kidney cleanse. Don't do it. So remember I said National Institutes of Diabetes and Digestive and Kidney Disease. This is what the page looks like. So it tells you what's chronic kidney disease. The language is easy to understand. It's written so everybody can understand. It has pictures. It lets you click the links on the side. So it's kind of easy to navigate if you're a little computer savvy. And if you can get somebody to help you, that was right off the site. That's another one. How do your kidneys work? So you can go in and you can learn. And I think Barb took care of all your questions, or resident answered, but please go to your providers. You don't understand, you have questions, ask your professionals. Ask, and then they can direct you to sites. But always know education's free, and we're more than happy to educate you with anything that we can.
And thank you for coming out on this rainy Tuesday night.
Yes, and we're really happy to present the education.
Even if I get dragged.
And boy, is she gonna get dragged again.
So thanks everybody for joining us. If you're online, thanks for signing in. The presentation will be available within the week on kidneywi.org. So if you have a friend or somebody who couldn't make it tonight, the presentation will be available online on the website later this week. So thanks everybody and have a good night.